name is Convalescent Branding, and I want to welcome you to Thistlecostia Hospital. This channel is open to tell you all about the amenities and how we can serve you. I hope your stay is extraordinary. We have many amenities that set us apart from the rest, including posturepedic beds, gourmet foods, and enough nurses to actually answer your call button within 15 minutes, guaranteed. Thistlecostia is not satisfied to just have that. We also have some pretty wonderful doctors. The Thistlecostia attitude is a part of all that they do. While we know you are already enjoying some of the amenities here, I would like to introduce you to a patient and the team that saved her life. Vanessa is probably the cutest patient to ever grace the doors here at Thistlecostia, and we think that you will agree her story is extraordinary. Without any further ado, let's introduce Vanessa Smith to the studio. Vanessa, we are so glad you're here.
Hello.
How are you feeling, Vanessa?
Really great.
That's extraordinary. Did you have such a good time at Thistlecostia?
No. I was really sick.
Well, thank you, Vanessa, for your talk. Alrighty then. No doubt the fever made it hard for her to remember. Now, let's bring out her parents, Aria and Zach.
Woo!
Was it scary when you had to admit your daughter into Thistlecostia?
Yes. It's very, very hard when your daughter is sick. She was sick for 3 days, and we had to took her to the hospital because she thought she had a virus, and she was starting to develop some other symptoms on the first day of the fever. She had red eyes. Then she started getting a rash around her mouth and on her body. Then, after that, we noticed that her hands and feet were swelling, so we took her to the doctor.
Fascinating. Now let's invite your family doctor to the show, Dr. Sarah Trumpets. She is called that because she trumpets her way into every room she goes to. Dr. Sarah is a part of the greater Thistlecostia system of providers. Come on in, Dr. Sarah. Hello, Dr. Sarah. Thank you so much for your grand entrance. I'm sure your patients love it.
Yeah, you would be surprised. Some patients are really not a fan. Don't know why.
Indeed, what a pleasant way to enter a room.
Oh, thank you.
What can you tell us about Vanessa?
Yes. She had a pretty troublesome case. She had a 202.5 fever for 3 days. Her parents had called me, and I did not think she needed to come in on day 2. Vanessa has a complicated birth history and small stature, so when she gets sick, she tends to get pretty sick. By day 3, I needed to see her. Honestly, I was more concerned that this would turn into an asthma emergency. When she came in, her lungs were clear, and I saw the rash. I thought perhaps this is the end of a virus. She had a small lump on the side of her throat. It was weird that the rash was in her genital area, and her feet and hands were swollen and red. I asked them to go home, continue monitoring her, and offering Motrin and Tylenol to help control the fever. She was then to return and see me 2 days later, which would be the 5th day of the fever. When she came in still feverish with the polymorphic rash looking much worse, especially around her mouth, I was concerned that this could be a serious illness and not a typical virus running its course. I felt strongly that I had seen this in the medical book before, but I wasn't sure what was going on and wanted to get her into more capable hands. I don't want to toot my own horn. Well, yeah, I do. But I feel like my strength is knowing what type of care is in the patient's best interest.
Oh, Dr. Sarah, you are nothing but trouble.
Oh, you know it. I know it. But I called my friend Dr. Nathan Capp, and he is pretty no-nonsense military doctor. But he is the best ID doc that I know.
Let's bring out Dr. Nathan Capp now. Welcome to the stage, Dr. Nathan Capp.
Woohoo! Hello, thank you for having me here today.
Thank you for joining us, Dr. Capp.
My pleasure.
Can you continue the story where Dr. Trumpet led off?
Roger. When Vanessa came in, she was on day 5 of 102.5 fever. She developed a conjunctival injection. The rash in her mouth and her tongue looked like a strawberry. The rash over her body had grown more intense from the pictures I was sent. Then she developed swelling at her extremities as well as her redness. Finally, the nodule on her neck had grown to the point that I felt confident in calling this cervical lymphadenopathy. I decided to run some labs in the ER and made sure a bed was ready on the pediatric floor.
This Stokostia has a truly spectacular pediatric wing. Don't you enjoy your time on the pediatric floor?
I enjoy children being well, not sick. May we move on?
Yes, sir. I love your devotion to the job. The Stokostia doctors are so passionate about their patients. Please continue.
Right. I ordered a CBC and a Kim 20 to get basic blood picture and added an LFTs to check her liver. And 2 inflammation markers, an ESR, and a C-reactive protein. Her white cell count was slightly elevated, certainly not high like I would expect from a serious bacterial infection that would have caused all these symptoms. Her CBC also showed moderate normochronic apnea and was very high platelet count. Her LFT showed a slightly low albumin, and her ESR C-reactive protein both showed sufficient inflammation. Although I had run throat and blood cultures to verify, I was very confident in my diagnosis.
Dun, dun, dun!
Yes, I felt strongly with the order of the symptoms and the lack of sky-high WBCs that she had Kawasaki disease.
Like the motorcycle?
Like the doctor in Japan who discovered it in 1967.
Oh, fascinating!
I thought it was possible that she could have scarlet fever, but Vanessa had not been sick leading up to the weeks before. Her white cell count was not elevated enough, and her lymphadenopathy was not found bacterial like I would expect in scarlet fever. But keep in mind, scarlet fever does have a fever, strawberry tongue, lymphadenopathy disease, skin rash, and discornumentation in common with Kawasaki disease. On the other disease that was close and acute rheumatic fever. But Vanessa did not have arthritis or cora, which is jerky involuntary movements. And I felt very confident of my diagnosis.
So did she need to be admitted to if you knew what she had?
Yes. Kawasaki's disease is an acute systematic vasculitis and predominantly affects patients under the age of 5. The inflammation of the arteries can cause aneurysms if not treated fully and carefully.
Oh my! How do you treat Kawasaki disease?
We admitted Vanessa and we began starting on an IVIG, which pulled a monoglobulin G and immunoglobulin from a plasma of approximately 1,000 or more blood donors. Donate blood, it saves lives. She took an IVIG over 24 hours. She'd also begun a regimen of high-dose aspirin. Of course, for her and her small stature, the dosage would not seem to be as high, but based on her size, she took 80 milligrams per day to spread into 4 doses is quite a bit, until she left the hospital at that point. She's still on aspirin now to prevent clotting of her blood. She responded very well to this therapy, and we were able to send her home. And her fever is now gone. The rash was improved, and her feet were beginning to peel, and we did an echocardiogram prior to the discharge, and it was clear. And we repeated the blood work and an echo prior to her 2-week visit after discharge. She was doing well. The good news is that she had a great prognosis, but it was still because of the quick work of the doctor, parents who were good historians and quick to follow up, and the continuing training that we receive that keeps rare diseases like this on our radar.
Wow, what would have happened if she had not been diagnosed in time?
1 in 5 patients develop coronary artery aneurysms. If not handled, it could get severely worse. 10. There are 5-fold reductions in risk. It was very important to start the IVIG treatment ASAP. Kids who develop aneurysms are not able to play sports and often need stents and surgery to fix this coronary artery disease.
I'm so glad that Vanessa will not need to worry about that. Isn't it amazing how the doctors and staff work together to get the right care for Vanessa? That is the Thistle Care way. If you ever want quality care, and by well-trained staff, in this classy environment, we are the hospital for you. Thank you for joining our show. Now, no doubt you are sitting in our hospital beds. I hope you feel well reassured that you are in the best possible environment. From all of us here at Thistle Hospital, we wish you wellness.